The autonomic nervous system serves as the major involuntary portion of the nervous system and maintains responsibility for the entire automatic unconscious body functions. It's all about diversity of receptors. The different receptors within the autonomic nervous system basically controls a number of mechanisms. Essentially, the autonomic nervous system controls all the automated functions, moment to moment subconscious control of body functions except the somatic system. As a result, it is responsible for the control of heart rate, control of stroke volume, gastrointestinal secretions, and basically muscle movement. The autonomic nervous system, as you know, is divided into two very important parts. One, the parasympathetic, and second, the sympathetic. The viscera are innervated by both the sympathetic and the parasympathetic divisions. Most organs receive dual innervation. Dual innervation means receiving input from both the sympathetic and the parasympathetic system. The sympathetic nervous system often is referred to as the fight or flight system, which speeds everything up. For example, increasing cardiac contractility, increasing stroke volume, and increasing blood pressure. The parasympathetic nervous system opposes this and is often referred to as the rest and digest system and slows everything down. Most organs receive dual innervation from both the sympathetic and the parasympathetic system. However, there are some exceptions. That exception is, for example, blood pressure is predominantly under sympathetic control, which basically controls blood pressure and basically vasomotor tone. The blood vessels in the periphery are predominantly under sympathetic tone. On the other hand, gastrointestinal secretions are predominantly under parasympathetic stimulation. As a result, parasympathetic systems slows everything down, and the sympathetic system basically is the fight or flight system and speeds everything up. So the blood vessels are predominantly under sympathetic, and gastrointestinal is predominantly under parasympathetic stimulation. The other important thing is understanding the anatomy of the autonomic nervous system. Both the sympathetic and the parasympathetic nervous system have relay stations or autonomic ganglia between the central nervous system and the end organ. These ganglia have nicotinic receptors, and acetylcholine is the major neurotransmitter. The difference is that the autonomic ganglia of the sympathetic nervous system lie in two paraventricular chains adjacent to the spinal cord, whereas the autonomic ganglia of the parasympathetic system lie at or close to the organ they innervate. Whether it's the sympathetic or the parasympathetic system, at the autonomic ganglia, acetylcholine is your major neurotransmitter. The sympathetic nervous system basically releases norepinephrine at the end organ, and the parasympathetic system uses acetylcholine at the end organ as its major neurotransmitter. Norepinephrine binds to specific adrenergic receptors, predominantly alpha 1, alpha 2, beta 1, and beta 2. Acetylcholine binds to its own muscarinic receptors, predominantly M1 through M3. Epinephrine, on the other hand, is released from the adrenal medulla, and epinephrine often is referred to as a neurohumoral substance because it has the ability to basically travel distances and bind to a number of different receptors. So acetylcholine binds to the cholinergic receptors, and norepinephrine binds to the adrenergic receptors. Norepinephrine carries a far more complex nerve terminal than does the acetylcholine, and this will be mentioned in the adrenergic system. The principal locations of the receptors, M1 is basically in the autonomic ganglia, M2 in cardiac tissue. The predominant role of M2 in cardiac tissue in the SA and the AV nodes is to slow down excitation in cardiac tissue by reducing the accumulation of cyclic AMP. M3 is basically in the smooth muscles and glands and causes contraction of the smooth muscle and glands. And then if you see NM type receptors, these are nicotinic receptors at the neuromuscular junction. They are directly connected to the sodium channel, and increased sodium flux is what basically causes muscle twitching. The next is the adrenergic receptor subtypes. In order to understand how the drugs modulate the adrenergic system, it's important to understand the main locations of the receptors. Alpha 1 is basically involved in smooth muscle and blood vessels. Alpha 1 causes vasoconstriction. The main role of alpha 2 is presynaptic. It sits presynaptically and acts to slow down sympathetic stimulation, blunt sympathetic stimulation, and to basically slow down the release of norepinephrine. Beta 1 receptors are predominantly in two places. One, the heart. It increases cardiac contractility by the actions of norepinephrine. And also beta 1 receptors sit in the juxtaglomerular cells of the kidneys, where they activate the renin-angiotensin-aldosterone system. And beta 2 is basically in bronchial and uterine tissue, where it causes relaxation. So alpha 1, vasoconstriction. Alpha 2, inhibition of norepinephrine release mainly. Beta 1, increasing in cardiac contractility and increasing secretion of renin. Beta 2, smooth muscle relaxation. And the smaller amount of beta 3 basically causes lipolysis. In the eye, they also play a role. The muscarinic receptors, which increases parasympathetic stimulation, causes miosis. The sympathetic discharge binds to the alpha 1 receptors in the radial muscle and basically causes adriasis. As a result, autonomic drugs play a role in glaucoma. Glaucoma is a disease where there's increased intraocular pressure, either due to increased production of aqueous humor or due to a blockade of the trabecular meshwork, either open angle glaucoma or closed angle glaucoma. Muscarinic agonists basically are used to increase the outflow of aqueous humor and basically reduce the intraocular pressure. Beta blockers, on the other hand, will reduce the formation of aqueous humor, and they are particularly used in closed glaucoma. As far as the autonomic innervation of the heart is concerned, you will recall from physiology that this is based on the baroreceptors in the aortic arch and the carotid sinus. The parasympathetic stimulation will slow down cardiac contractility, and sympathetic stimulation will increase cardiac contractility. All the feedback mechanisms are controlled by the baroreceptors in the aortic arch and carotid sinus. Therefore, the overall effects of autonomic drugs on blood pressure are pretty complex. They may either have a direct effect on the heart by the beta 1 receptors, they may have vascular effects by the alpha 1 receptors, or they may redistribute blood, or you have reflex phenomena, and that reflex phenomena may manifest as either reflex tachycardia or reflex bradycardia. Therefore, in the sinoatrial node, you'll have an increase in heart rate. That's predominantly the beta 1 receptors. The beta 1 receptors will cause an increased contractility and conduction velocity in the atria. In the AV node, they will increase automaticity and conduction velocity. And the same will happen in the His-Purkinje system. And in the ventricles, the beta 1 receptors will increase contractility. In the coronary system, the beta 2 receptors will cause dilation, alpha 1 constriction. Alpha 1 will cause constriction in the skin and mucosa, and alpha 1 will cause constriction in skeletal muscle particularly. And this is the baroreceptor reflex, which is very important in understanding blood pressure mechanisms. In a nutshell, if blood pressure goes up, This homeostatic mechanism works basically to increase parasympathetic firing and decrease sympathetic firing. This results in vasodilation and also reduce cardiac contractility, which will drop blood pressure. A reduction in blood pressure will reduce parasympathetic firing and increase sympathetic firing, because it will increase cardiac contractility and also activate the renin-angiotensin system, which will result in an increased vasoconstriction and retention of sodium and water. In the gastrointestinal tract, predominantly it's the parasympathetic tone, and increased parasympathetic tone will basically increase GI motility, and this is what's responsible for increased GI secretions, diarrhea, and involuntary defecation. And renin secretion has been mentioned, very important. It's the beta-1 receptors in the juxtaglomerular cells that basically activate the renin-angiotensin-aldosterone system and increase angiotensin II and aldosterone. If you recall, angiotensin II is a potent vasoconstrictor, and aldosterone basically will aldosterone will increase the retention